Hello, class and Dr. Jenkins. My name is Nikki Bristol, and I will be doing a presentation on xylazine. Xylazine is a non-narcotic compound that is also known as tranq or tranq dope that was discovered in 1962 and was promoted for use as an antihypertensive medication. Although approval was not granted for human use due to the excessive central nervous system depression and significant hypotension, it was approved for a sedative to provide muscle relaxation and pain relief for veterinarian use. And it is now currently approved as a non-opioid tranquilizer in veterinary medicine. In the early 2000s, xylazine emerged to become a popular illegal substance used in Puerto Rico. It has gained its popularity as it is used as a cutting agent, an illicit drug to increase the bulk and decrease the net worth, which will improve profits. Xylazine is liquid in its original form. However, its recreational use, it is dried to a white or brown powder. Individuals are typically first exposed to xylazine without knowledge within their use of fentanyl. In 2023, xylazine was recognized as an emerging threat, and the White House released a national response plan to combat its use and devastating side effects. Xylazine provides a sedative and opioid-like sedation that creates a euphoric effect. Its use has spread rapidly due to its ability to cut costs and the ability to extend the duration of effects of opioid that it is combined with. It can extend the high traditionally from 30 minutes up to 72 hours, depending on the amount and tolerance of the individual. Xylazine was first detected in Philadelphia in 2015. By 2022, it was detected in 48 out of the 50 states. This geographical spread caused a significant concern. Precise demographic data is still being collected and studied. However, it has been found to be popular in individuals who have a substance use disorder already related to opioids or who are polysubstance users. Like I had mentioned previously, risk factors are those who are involved with illicit drug use, individuals who lack xylazine awareness and are living in poverty. Studies have indicated that the vulnerable populations are typically non-Hispanic white males, the homeless population, and those who are middle-aged. Short-term effects cause immediate hypertension and tachycardia, followed by severe, profound hypotension. Other short-term effects include bradycardia, dry mouth, and in severe cases, cardiac arrest and death. Long-term use causes chronic complications in various organ systems that are still being studied. Non-healing wounds or ulcers on the skin have a high prevalence that lead to necrosis and amputations. Signs and symptoms of abuse upon assessment are those similar to opioid intoxication. Initially, there is, like I had mentioned, an increase in blood pressure to follow with a significantly low blood pressure, decreased respiratory rate, decreased heart rate, slurred speech, an unsteady gait, confusion, disorientation, and a loss of consciousness. The potential to overdose on xylazine is significantly high as there is no antagonist for the drug. In 2015, less than 1% of overdose deaths contained xylazine. In a study that was conducted using 10 major U.S. cities, in 2020, 7 contained xylazine. One study in Philadelphia and Pennsylvania in 2019 detected xylazine in 31% of their overdose deaths. A study conducted in Maryland tested needles between the years of 2021 and 2022 and xylazine was present in more than 80% of those samples. The average monthly percent of overdose deaths involved xylazine in 2022 was 11%. Naloxone should always be given if an overdose is suspected, as it is typically mixed with opioids. During my research, I found that in 2023, in the very small state of Vermont, where I was born, raised, and currently live, exhibited to have the highest overdose rate with xylazine. I was very taken back by this information, as I currently work in a rural hospital in an emergency department, and we are just beginning to see cases of overdose where xylazine is involved. There is currently no evidence where xylazine is used as a means of intentional suicide. Xylazine pharmacological management includes symptom management, as there is no pharmacological agents for xylazine intoxication or detox. Non-addictive medication can be used for symptom relief, like clonidine, to help with anxiety and muscle aches. Non-pharmacological management consists of cognitive behavioral therapy to address thought patterns and help with coping skills. Motivational interviewing can provide motivation to change. Support groups, including NA meetings to build therapeutic relationships, are also recommended. Patient education. It's very important to educate the patient about xylazine and the dangers of its use. Help patient develop coping mechanisms and provide local as well as national resources. Referral to substance use treatment specialists. Sometimes that's done in an inpatient or an outpatient setting. And if intoxication is suspected, referral to get a medical evaluation is also recommended. Schedule follow-up visits every 1 to 2 weeks during the initial stage of treatment in order to monitor progress, assess response to medications, and provide ongoing support. Creating a long-term management plan is crucial to include support groups, referrals, follow-ups, and this all helps to minimize the risk of relapse and ensure sustained recovery for our patients. In conclusion, xylazine has unveiled its growing significance as a substance use disorder in the United States. Initially developed as a veterinarian sedative, xylazine has now emerged as an addictive illicit drug, particularly in combination with opioids like fentanyl. This vast spreading use has marked a noticeable increase in its prevalence and the associated risk to public health. We now have knowledge xylazine is increasingly affecting vulnerable populations, often those who are already struggling with substance abuse disorders or who have low economic status and challenges. These populations are at a heightened risk due to various factors, including mental health issues, the availability of the drug, and social determinants of health. The short and long-term side effects of xylazine can be severe, leading to significant physical and mental health complications, such as sedation, respiratory depression, and skin ulcers. Awareness of the signs and symptoms of xylazine abuse is critical for early intervention and treatment, as many people who use this drug are not aware or recognize the risks they are taking. We have also discussed the importance of a comprehensive care plan for managing xylazine use. This plan mostly encompasses non-pharmacological treatments, includes education, ongoing support, and a robust referral network to ensure the best possible outcomes for individuals who are struggling with xylazine. It is essential for us as future nurse practitioners to deepen our understanding and education of xylazine and its implications to better assist our patients towards their recovery. I hope you enjoyed this presentation. Thank you.